My name is Evelyn Mudhoni Kaburia from Kenya. I came in India in April through a recommendation to Dr. Meet. When I met Dr. Meet, I was so happy because he started my journey he detected that I had POEM syndrome. I didn't know the disease before. He said it was POEM syndrome, and I thought it was a very difficult journey to go. But he made it very easy to know that I can make it and there is no problem. So when I started the journey with them, I've always been encouraged day by day. The drugs were not as on me as I was told by people. They took the responsibility to take every step and every day. And they acted in everything which came around.
She is Miss Evelyn and she's from Kenya. She had contacted me almost 8 to 9 months ago when her only complaints at that time was she was having continuous requirement for blood transfusion. So her only complaints was she was having a requirement for blood transfusion, and along with that she had some intermittent fevers. She had a history of swelling in both her feet that was there for almost a year from now. So she had been worked up there back home, but unfortunately there was no diagnosis that could be made. Someone told them that there is a problem in the bone marrow, there is some other problem, some liver problem, some kidney problems, but no one could reach a concrete diagnosis. So one of our friends who lives there, he had actually referred that patient to us in Marengo Asia Hospital. We worked her up completely. So there were some confusion as to diagnosis, but ultimately we reached a final conclusion that what she is suffering from is something called as POEM syndrome, POEMS. That is a type of blood cancer, a subtype of plasma cell dyscrasia, which presents usually with slightly different features as compared to a typical patient of multiple myeloma. That is actually a much more type of common blood cancer. So she received the treatment here with us at Marengo Asia Hospital. She completed 4 cycles of chemotherapy, after which her disease burden was brought down significantly, and recently she underwent an autologous stem cell transplant for this rare disease called POEM syndrome.
Her autologous stem cell transplant went really well and her cell dose was great. So after the stem cell transplant, she had a very comfortable course. We were able to discharge her on the 11th day post-transplant without any significant post-transplant complications.
On this transplant, patient received extensive chemotherapy as melphalan we gave, and that time patient goes under very severe neutropenic phase. That time patient was neutrophils is going 0, and we work on that time to manage the infection control practices. We work a lot to prevent infections on the patient. We are doing a lot of hand hygiene practices, follow our infection control practices, reverse barrier nursing, how to handle the lines. So totally we work on infection control practices on very extremely basis, and we always try to give 0 infection during the all transplant period. Right now patient is discharged with 0 infection and she is very happy with the treatment, and always we are trying to give our best to reduce infection and provide good nursing care services in Marengo Asia Hospital, Gurgaon. Thank you.
We have discharged her with the hope that she might be cured of her disease. So with this, we want to say we are here to serve people. We are here to serve patients who require bone marrow transplant, specialized treatments like bone marrow transplant, and we will do our best to justify that treatment. For more details, you can contact us at Marengo Asia Hospital. Thank you.
Marengo Asia Hospital was so kind to me. Nurses and the supportive staff were very good. They were kind, generous. They talked and laughed, and the whole journey felt I was comfortable and I am not even sick.